Hi guys, welcome back to our tutorial. So today we shall talk about ibuprofen, commonly known as brufen. So we shall talk about some of the uses of the brufen. We shall discuss about the dosage and even the side effect of the brufen. So at the end of the lesson, we should be able to know some of the uses of the brufen and the dosage forms we have for the brufen. Apart from the dosage form, we should also have to know the specific quantity, the specific amount, the frequently in which we can take the brufen, and some of the most common side effects of the brufen, and even some of the unknown side effect of the brufen. Okay, so to start with, let us look at the overview of brufen. So brufen comes in different brands, that is Adril, Advil, Motril, Brufen, Adapril. These are some of the a few known brands of Brufen. There are wide variety of brands worldwide. So Brufen fall under a class of medicine known as non-steroid anti-inflammatory drugs. In short, NSAID. So Brufen is commonly used to treat pain. We can also use it to reduce inflammation, and we can also use it to reduce the fever. So when you take brufen, there are some of the common side effects you can expect. So some of these common side effects are like fluid retention, the rashes, stomach ache, even nausea, dizziness, ringing in the ears. Those are some few common side effects of the brufen. So now we shall look at some of these side effects in and how they are caused. What are how do we help? Okay, how do we respond to these side effects? Now, there are some contraindications that are necessary when we take brufen. So, people with the GI diseases, cardiovascular diseases, liver diseases, impaired kidney or bleeding disorder should avoid brufen. Now, if you have this condition, you should totally avoid taking brufen. So when you have fever, when you have inflammation, or when you have pain, you should seek for another alternative. Now, ibuprofen is used to treat various conditions. Some of the conditions are like menstrual pain, arthritis, fever, even migraine pain, migraine headache, gout, headache, dental pain, very important, sprain, strain, sore throat, backache, and even pain that result from cold flu. These are some of the various uses of brufen. Now let's look at how ibuprofen works. So ibuprofen works by blocking the cyclooxygenase 1 and cyclooxygenase 2, which decreases the production of prostaglandin, a precursor in the body that results in pain and inflammation. So COX-1 plays a vital role in the maintaining gastrointestinal mucosa lining. It also help in kidney function and platelets aggregation. COX-2 is inducibly expressed during an inflammatory response. Okay. So from our diagram, from our diagram, you can clearly see that cyclooxygenase is required to convert arachidonic acid into thromboxane and prostaglandins. Okay, now thromboxane play a role in platelet adhesion. Prostaglandins causes vasodilation. It increases the temperature set point in the hypothalamus and play a role in nociception. Okay, now COX-1 plays a role in maintaining gastrointestinal mucosa lining, kidney function, and platelet aggregation, while COX-2 is inducibly expressed during an inflammation response. Okay, let's look at over-the-counter adult dosing. So one tablet is required to be taken every 4 to 6 hours. Now, if symptoms persist, you can take 2 tablets. Okay, but you should not exceed 6 tablets in 24 unless you are directed by the doctor after a considerable examination. So Brufen is best taken with milk to reduce stomach upset. So let's look at prescription dosages. So for fever lower than 39.2 degrees Celsius, the dose usually is 5 milligram per kg of body weight. For higher fever, the dose is usually 10 milligram per kg of body weight. The medicine may be given every 6 to 8 hours as needed, up to 40 milligram per kg per day. For menstrual period, menstrual cramps, adults should take 400 milligram every 4 hours as needed. Okay. For children, for mild to moderate pain, adult and teenagers should take 400 milligram every 4 to 6 hours as needed. Now, for children over 6 months of age, the dose usually is 10 milligram per kg of body weight every 6 to 8 hours as needed, up to 40 milligram per day. For osteoarthritis and rheumatoid arthritis, adult and teenagers should take 100 should take 1,200 milligram to 3,200 milligram per day, divided into 3 or 4 equal doses. For children, the dose is usually 30 milligram to 40 milligram per kg of body weight per day, divided into 3 doses. Now, let's look at some of the functions of prostaglandins and how ibuprofen inhibit or affect the functions of prostaglandins. Now, one function of prostaglandin is to activate or inhibit platelet build-up for blood clot formation. Now, the body produces thromboxane and what? Prostaglandin. Thromboxane is very important in platelet adhesion, especially on heart. Okay, while thromboxane, prostaglandins inhibit platelet buildup for blood clot inside the vessel. So when we have clot inside the vessel, there are various diseases that can occur, such as deep vein thrombosis, pulmonary embolism, arterial thrombosis. Now, when we have prostaglandins, we prevent such diseases. So prostaglandins help us in preventing such diseases. Okay. Now, another function of prostaglandin is it causes vasodilation or vasoconstrictions. Okay. So generally, we can say prostaglandin help in blood pressure regulation. Okay. So when we prevent formation of prostaglandin by ibuprofen, the blood pressure will fluctuate. Okay. Another important factor we should function we should consider is it causes prostaglandin causes bronchoconstriction, or that is narrowing of the air pathways, or bronchodilation, that is narrowing of the air passageways. Okay. Now, what happens when we have bronchodilation? There is possibility of asthma attack. So prostaglandin is very important in regulating between bronchoconstriction, when do we have bronchoconstriction and when we have bronchodilation. Okay, so that is why ibuprofen is not required, is not necessary or recommended, okay, for asthmatic patient, because it will prevent prostaglandin, which is very important in regulating between first bronchoconstriction and bronchodilation. Okay. Now, prostaglandin causes fever. Now, this is where now Brufen help, because when prostaglandin causes fever, now Brufen will help in reducing that fever. Okay. It also influence pain and perception. So ibuprofen will reduce that production of prostaglandin and help in reducing that pain. Okay. Now, another important function of prostaglandin, because it induce labor through uterine contraction. Okay. This is very important. Now, if you take Brufen, then we will not have labor. Okay. Labor pain is labor is required for pregnant women. Okay. Okay. So it also causes uterine to contract during menstrual to shed the uterine lining. So that is why women, most of ladies take ibuprofen to reduce menstrual pain, because it causes uterus to contract during menstrual period. It decreases the pressure within your eyes. Okay, so when we have ibuprofen, we take ibuprofen, then the pressure inside the eyes will increase and may have problem with the eye. Now, prostaglandins, the main factor, the main important of prostaglandin is to regulate several hormones. Okay, so if you take ibuprofen, there's possibility of hormone imbalance, because we are going to reduce the production of prostaglandins, I mean. Okay. Now, some of the side effects, most common side effects of ibuprofen is stomach pain. Okay, because of reduction in prostaglandin, which is very important in gastric protection. So when we take ibuprofen, there will be no gastric protection. So the hydrochloric acid will burn the stomach. The same happens to heartburn. Okay, it also causes heartburn. It causes nausea. Those are just side effects of the overproduction of the acid. It's not generally overproduction, but high increased number of acid in the stomach. The increased amount, not number. It causes dizziness. It causes ringing in the ears. Okay. Now let's look at ways of reducing the risk of ibuprofen. Now, one way of reducing the risk of ibuprofen is to take a lower dose for a short period of time. Okay, so you should avoid taking ibuprofen for a long period of time. Not every time you encounter fever or pain, you take a higher dose of ibuprofen. So to prevent this risk factor we have discussed, you have to do what? You have to take that lower dose for a short period of time. Generally for 3 days, it's okay. Okay. Another way of reducing the risk of ibuprofen is to switch to a different NSAID or class of medication. Okay. Now we have two type of NSAIDs. or two classes of NSAID, that is COX-1 and COX-2 non-selective inhibitor. Then we have selective COX-2 inhibitor. Okay, now remember COX-2 is only invisibly expressed during an inflammatory response. Okay, so when we take selective COX-2 inhibitor, we will prevent all these side effects we have discussed. Okay, another way of reducing the risk of ibuprofen is to take proton pump inhibitors such as omeprazole. This proton pump inhibitor will help in reducing stomach risk. Okay, another very important factor to consider is to monitor the side effects of ibuprofen. So when you take ibuprofen, it's very important to always monitor some of the side effects. Okay,